Hi, I'm Caitlin, and I have cystic fibrosis. So basically, I was born in 98, and they didn't have testing. Well, they had testing, but they did not have the cystic fibrosis testing screenings right when you were born, like they do with all the baby screenings. So basically, what happened was, after a few days, my parents took me home because everything looked good, and I wasn't keeping food down, anything.
Okay.
I was always puking it up or something. And so my mom was like, okay, well, something's not right. We're going to bring her back to the hospital. So they did. And come to find out, I had a blockage in my intestine. And so I got rushed to emergency surgery. I was 5 days old. They had to remove it. I mean, it was life-saving surgery, so cut it out and everything. And
did they know what the blockage was?
It was it's some long science word that I'm not gonna say right.
Okay.
But
so don't even attempt.
Yeah, so it was just a blockage in my intestine.
Okay.
And they removed it, and then I went into the NICU. I was underweight, and I mean, I guess I was just sick, and they didn't know why. So I was kept in the NICU for observation and all that stuff. And then they tested the thing that they removed, the blockage they removed, and what the blockage was, so it was something specific, but like I said, I'm not trying to butcher the name.
Yeah.
They tested it, and they're like, oh, they sat down with my parents. This is very common with, babies with cystic fibrosis. And my parents have heard of it, but back then, too, it was even less known than it is now. So they're like, what is that? So then the doctors were like, do we have the green light to test her for cystic fibrosis? And my parents were like, well, yeah. Mm-hmm.
So basically, the blockage is what made it stand out.
Yeah.
Okay.
And I really don't know. I mean, if they didn't remove it, I probably would have died.
Right.
So there's I got a nice little bingo card.
Yeah.
I have dark humor. I have a nice little bingo card of death ages I should have died. Mm-hmm. And it's comical to me, so if we laugh about it,
we all have those.
It's good. So that's one of them, because if they didn't do it, probably would have died. And
you wouldn't be here today.
No. So basically, that comes back. They're like, yeah, she has cystic fibrosis. So that kind of starts the whole CF journey, mm-hmm. or timeline. So throughout when I was younger, I don't remember a lot of my young childhood anyways. Maybe a lot of people don't, but up until 8, 9 is when I started remembering stuff. But basically I can't talk.
I never can either, so don't worry. Really.
In CF, you can culture different bacterias, and I culture one of the worst ones. So the most common one is Pseudomonas.
Okay.
And I culture Burkholderia cepacia, or as they call it, just BC. Mm-hmm. And that's bad. There's antibiotics, IV antibiotics, and oral antibiotics for infections. And mine is just really antibiotic resistant. There's a select few. So basically that was another thing too that kind of marked it she's going to be even harder to treat. Mm. So cystic fibrosis is a lung disease. It's a genetic lung disease. So, you can't catch it from somebody or anything like that. So basically your parents need to have one gene each to kind of put together and fuck you up.
But neither one of your parents have it, right?
No.
Okay.
You need 2 messed up genes to make it.
Got it.
And they each just have 1. So then they're carriers, but they're not going to actually have it.
Okay.
And so those 2 had, I don't blame it on them either. Those 2 had fucked up genes, and then they just got together and they gave it to me.
Yeah.
Also, the chance of that too is a 20, what is it? I think it's it's a 1 in 4 chance that you're going to be actually born with it over
Right.
being a carrier. So the fucking odds.
Right. There you go. You're the lucky one.
I know, right? Like, great. So it's targeted as a lung disease. Lung and pancreas is like the two main things. And there's stuff that can scatter off from it. But that's like the main thing. It's a lung illness. Causes you to have a ton of like buildup of mucus in your lungs and in your whole body. So like, yeah, all your different organs have just overflows of mucus. And in the lungs, it causes you to cough up heavy mucus. And when it sits in there with really anybody too, like if you have mucus sitting down your chest, you're going to get an infection and it stays. But like people without CF, they can get that up. CF patients can't. It's just stuck to your lung walls because you have a nice little level of like liquid. It's not like in your lungs to unstick that stuff. But with CF patients, you don't have that, so it's lower. Okay. So it just stays in there and causes infections.
So do you constantly have to be on medicine?
Oh yeah, I had a beautiful like own little hospital cart of medicine before the medication I'm on now, because the medication I'm on now is like the only reason I'm alive today. Okay. Because we'll get there. Okay. So that's kind of the basis of it. And CF can be described as much more, and there's a lot that can branch into it. There's like CF related diabetes. You know, some people can get liver failure, kidney failure, because your organs are just working extra hard and blocked up with a lot of crap. So it's like, you know, I guess, you know, as you go on with life, you get what you get. I only have problems with my lungs and my pancreas. So basically, like, I can't eat food without taking pancreatic enzymes. So, like, there's these little, like, capsules. And if I don't take them, I can get a blockage like I had when I was born. And I need to go to the hospital and go through this whole thing. Not a crazy surgery. I haven't had one that bad again. But I have had two blockages in my life, and they are painful.
Is it like stomach pains or?
Yes.
Okay.
It's like
you wouldn't believe kind of thing?
That was one of the like top 3 pains I've ever felt in my life. And
so you have to take one of these capsules with every single meal, like even if you have a snack.
Yeah, it's like anything with fats, like a glass of milk. It's like the enzyme count is like I need 6 with meals, or 6 to 5 depending on the meal size. 4 to 3 with snacks. Like if I want a glass of milk, it's like 2. Anything that has to go down like that. Like I can have fruit and juice, water, without them. And all CF patients are different with that too. Okay. Like the enzymes are completely different to each patient. When I was little, the enzymes have a certain amount of like lipase, or I believe that's a word, and something else. So basically, like you guys have like digestive enzymes naturally in your body, and that comes from, you know, like your pancreas and stuff. I don't got that. So my pancreas just doesn't have the digestive enzymes to break down my food. Right. So that's what they are. And you work with your CF team from when you're like a baby. Because I was taking them and eating solid foods like right when I was out of the hospital. Like my parents were feeding me applesauce at like 2 weeks old. Yeah.
Because of the blockage, to prevent that happening again.
They had to get my enzymes down for any food, any formula. So they'd take like solid applesauce, which you're not really supposed to give a 2-week-old applesauce. But they'd have to break open the capsules, sprinkle it in the applesauce, and feed it to me at like 2 weeks old for any of my formula or any foods, because if they didn't, it wasn't going to digest. And then, you know, if you don't take them, you can get bowel obstructions or blockages. So like the bowel obstruction aspect would be like your bowels are going to explode. Your stomach is going to explode inside of you and you die. Right. So, and I've had 2 of those. Really? After that removal surgery when I was 5 days old, I've had 2 blockages. or bowel obstructions as they call them. Obviously my stomach didn't explode because I'm not dead. But it can get that serious. So, but you know when you have them. It hurts.
Based on the pain.
Really bad. Okay. And you just get really bloated and you go to the hospital and then one time they pumped my stomach with like a giant tube down my nose. Unpleasant. It was unpleasant.
I'm sure.
And I don't remember what happened the other time.
Yeah.
But.
So I do have a question. I get, and if you're going to get into this down in the line of your story, that's fine too, if you want to wait. But I was just going to say, like, as far as your daily activities go, like, do you notice that there's a lot of things that you can't do or like that are a lot harder for you?
That's actually like the next.
All right, well then go ahead, take it away.
So, fast forward now, going into like my younger times, I'll like try to sum up until I was about like 13, 14, because then I'll hop into like high school and go from there. So in this time period, I was doing a lot of different things. I was young. I had interests. I wanted to do dance, sports. So I was in soccer, softball, and dance. So I was a very active kid. And for having a lung illness, I did a lot. Right. So
did it affect you at that time?
Yeah. Okay, that's like it. So I had to stop soccer at like the age of 8 because I was starting to play. I think I played like little soccer. So I was like, I don't know, 7 when I started. And I had to stop like at like 8 or 9.
Right.
Around there. I'm trying to think of the ages, but I really can't like pinpoint them. But it was just too much running for me. I wouldn't be able to breathe, and I just couldn't keep up. So that's something I had to quit. And I know I was really sad about that. And I continued with dance, and I was kind of just given leniency in some activities when we'd have to do like excessive things that were hard on my lungs. And this did get like progressively worse as I got older and I had to keep dropping things. I played softball for a long time. That's the one I got to really hold on to, and dance, because that one wasn't too
it wasn't like constant.
Yeah.
Right.
And even if they had us doing something constant, I was able to like
sit out for it or something. Yeah.
So I actually played softball from like the age of 8 all the way like up in like almost into high school. So with the whole sport thing, up into high school, I was trying to try out for our high school team because I was still playing. Because running base to base kind of gave me a breathing break because it got so much worse around that high school time. But I wanted to do something. It's really hard when you have interests in things you love that you can't do anymore because they're getting like ripped away from you because you just like can't.
Just can't, right.
So I held on to that as long as I could, but I started getting really sick in high school. So that was something. They wanted us to run a mile, and I was like, see you later. It's not for me. I was like, I can't run for 2 minutes. So that's something I had to drop to around that time, but I did drop a lot of activities and things I couldn't do anymore due to my lung issues. Another really important thing too that I had to let go of too is when you have cystic fibrosis, you can't be around other people that have cystic fibrosis because you can pass I can't pass like my lung bacteria to like you guys. I don't know the science quite behind how we can pass it to one another, but I could give my bacteria to them or they could give their bacteria to me.
That is so interesting.
It is. I'm not really quite sure, like, again, like the science behind it.
So you can't be around anyone that has cystic fibrosis because of that reason.
Because, like, and with my bacteria being so bad, if I gave it to somebody, like, it can do really bad things. Yeah. But I mean, like, if I got Pseudomonas from somebody else on top of what I have too, I can get really sick. So it's like you're just killing each other.
Then you would have both if you were to get that. Okay.
And I had a good friend of mine. She's still a good friend of mine to this day too. Her name's Sarah. Before the whole 5 feet apart. Have you seen the movie? Yeah. So it's actually 6 feet, but they do what they will. So before that became a thing, because when I was younger, me and Sarah would have like play dates and stuff before it was a problem. We never passed bacteria to one another. That never was an issue. But, you know, that became a thing. And then that's something else that got ripped away from me too. And it's harder now than it was back then because I didn't quite understand. It was just like, you can't really, you know, see Sarah in person anymore. And I was confused. I'm not sure why I was young. And now that's, you know, it's happened to me in my older life too. Trying to have relationships like that with friends that I can't have in person because of that. And it really sucks. And it's really lonely. And especially like growing up with an illness like that, it's like you don't have people to be there and support you, I guess, like in person. Like we can talk to each other over the internet, but it's so different to, you know, be able to have someone with you in person being like, oh yeah, we're going through the same thing. Absolutely. So it's a very like lonely disease. And it's like, that's done a number on me too. Cause it's like, no one is going to understand what we're going through except for like each other. Yeah. And I mean, you have the outside perspective, like my mom and dad, I do feel for them having to watch like me grow and their child like be very sick. Right. But it's like, you know, they're not going to understand.
Yeah. Like they experience it with you, but they don't have it. Yeah.
You know, it's like they're going to have they're going to have their experience and I'm going to have mine, but
they're still different.
It's like, you're not going to feel what I feel physically when I know other people are feeling what I'm feeling physically and we can't do anything about it. Like, so that's lonely. That's another thing that got taken away. So that's kind of like what happened in that aspect. That was a lot of stuff I couldn't do or stuff that got taken away from me at a very young age. Other than that, I lived a pretty normal, younger life. Got to hang out with my friends and do whatever. I mean, well, I guess like some time got taken away from me too because with CF you need to do treatments, like breathing treatments. So, you know, like nebulizers. Okay. If you ever had to do like anything like out with the pods for like, or not the pods, but the little cups for like asthma.
Yeah. So how often do you have to do those treatments?
Oh my gosh. Those were like, they've always been for me 3 times a day. Okay. Like 30-minute sessions 3 times a day when I was little. And also with CF2, you have this vest. So like, think of like a life vest. You strap it on and it blows up and it just shakes you. It like just shakes your chest.
And that's to help with the mucus, like break it down kind of thing?
Yeah. Okay. So like, that helps like loosen it up. And then like to help like break down the mucus and stuff would be like more like the meds that you put into the nebulizer. So that took up a lot of my time too. So I guess that's something else that was taken from me too, because that was always a very important thing. If you don't do it, you're going to keep getting sick and then infection after infection. And the more infections you get, the more lung scarring and everything that you're doing and the more lung function you lose. And, you know,
yeah. So if you were doing it 3 times a day, was it morning, midday, evening?
Yeah.
So were you having to do it when you were in high school? Were you having to like, did you go to the nurse to do that? Or was that something like, how did that work?
Before school, after school, and like dinner-ish
Okay.
time.
So you wouldn't do it when you were at school?
No. Okay. Because when I got sick enough, because when I got older, you know, it moves up to like 4 or 5 times a day.
So now you have to do it more than you did. Okay.
And so that...
One more question, not to interrupt. No, is that kind of how this is? Like with age, it gets worse?
Yeah, it's like... Well...
Or it depends.
It's like, I guess, yeah, it depends on your like severity, I guess, too. But it's always just a progressive disease. Okay. I believe regardless, I can't really like speak for others. I know there's like... But everything always just kind of progresses. I mean, everybody ages and everything kind of, you know, slows down and gets, you know, older. So it's usually very just progressive and things just have to keep getting upped. So like medications, treatments, and not a lot happened within my young ages. Like I was in and out in the hospital a bit. Right. But that's just daily like routine, like tune-up type of deal. And by tune-ups, like a car.
Like, when you say that, do you mean like adjustments of medicines and things like that, or?
And those I use that own little word myself with my family to be like tune-ups. We're going in to have a tune-up. So you go into the hospital. I was in the hospital at least once a year from when I was 1 year old up until high school when it got like pretty bad and I was in there way more often. But so you go in for like tune-ups, and that's basically just like IV antibiotics for a certain amount of time, whatever your clinic felt was necessary to just get your shit straight.
Okay.
In your,
right,
lungs and stuff, or like just So that's what that would be.
Okay.
So it's just frequent hospital visits. So shit hit the fan. I missed a part, actually.
Go ahead.
I'm going to backtrack.
You're okay.
So when I was 10, this is actually because it's important. This is very important. So when I was 10, I was still very underweight and like not gaining weight. I couldn't keep weight on. That's a common thing with CF too, is not being able to keep on weight, being a small thing. So my team pushed for a feeding tube. I don't know if you've ever heard of those, but they're okay. So
you can still explain it anyway.
Yeah, there's two different kinds. I'm not really sure which one I had specifically, but I had to get that placed when I was 10. I never really used it. I never wanted it. I was like, don't give it to me.
Right.
But I was like 10 years old and like 50 something, 60 pounds. So they're like, no, this isn't working. They wanted me to put on 20 pounds first. So then they placed the tube. I used it a few times. Every time I used it too, I would just throw up.
Really?
So I would wake up in the morning because I do feeds through the night by this machine that just stood by my bed.
And it would go into your body as you were sleeping?
Yeah. You just attach this tubing to the feeding tube, and while I'm sleeping, it's just I'm getting extra calories.
Okay.
Because I couldn't put weight on with just eating myself.
Right.
And in the morning, I would just throw up anyway. So it's didn't even matter. And that made it even more annoying. That whole time period of my life was so frustrating.
Yeah, I'm sure. It's also probably just not comfortable. It doesn't feel natural, I feel to the body.
No, it didn't. I had this tube thing just sticking out of all. Oh, and being I think you could relate to this also, just being a young teenage girl with something sticking so far out of your shirts and stuff. It's I couldn't really wear any tight fitting clothing because everybody's gonna see it. It would leak stomach acid over my shirts. The shirts would get ruined. It was just an awful time.
Yeah.
So I got it removed.
How long did you have that in for?
3 years.
Wow. So you had it for a while.
Yeah.
Okay.
They wouldn't let me get it out.
Even though you were throwing up?
Yeah.
Okay.
They're
would you
it was
only
for my
have
best. They were looking out for the best.
Right. Would you only have it kind of giving you those extra calories when you were sleeping, or would you would use it during the day as well?
I never used it during the day.
So just at night?
Just at night.
And then during the day you would eat your own food?
Yeah.
Okay.
Because I guess that wasn't enough.
Yeah.
So
you had it 3 years, and then you got it taken out.
Yeah. So I got it taken out right before I got into high school. And I kept putting on the weight too, they asked me to. They wanted me to be in a comfortable weight. So they wanted 20 pounds. I gave them 20. And then when I was all right, take it out, they're well, we're not gonna just yet. I'm what do you mean? It was such a frustrating time in my life.
Right.
And growing up and all that stuff, and now stepping into high school, I told them, I was I don't want this going into high school. I already had to deal with it for this long. I want it out. And so my weight got to a comfortable enough point where they were okay, if you really want to, we'll take it out. I go to get it out, and it's supposed to be, you can just pull the tube out, and then you just have this hole in your stomach, but it's supposed to just close up. Mm-hmm. They're sometimes that won't happen, and we'll have to surgically close it. And yeah, that didn't happen.
The hole didn't close.
No.
So
didn't.
Once again,
I'm in my freshman year of high school.
Okay.
And
you got the unlucky card again.
Yeah.
Got it.
I'm in freshman year of high school, And this was even worse because, like I said, like it would leak stomach acid onto my shirts. But this time around, it was even worse because I had this hole.
Right.
I'm walking around and like it would just leak out stomach acid so bad that it covers like this whole bottom section of my shirt and then starts leaking down onto like my like pant like belt area. So it would ruin my shirts and my pants. I'd have to call my mom, go to the nurse, and she'd have to come get me. I'd have to go home. And then sometimes it hurts too. It burned my skin because it's stomach acid. So at this point, excuse me, at this point, I'm like, I don't even want to go back to school. I'm just going to stay home. I'm in pain. My shirt's ruined. I'm like, no.
Right. And probably also the, maybe not anxiety, but the worry that it's just going to happen at any time. Right.
It's embarrassing too. I'm a freshman in high school walking around with a giant like yellow stain on my shirt. And I'm like, I don't want to be here.
Yeah.
So that happened. Then it got surgically closed. Few months. I had to deal with that for a few months. But this is where I can like branch into my health starting to really decline. Because I got into my freshman year of high school. I was dealing with that issue. But within like the second week of high school, I had to leave and I was gone for like almost a month because you have lung function. Well, everybody does. But like with CF, your lung function is a important factor. At this point, I think I started high school with like a mid 60s, low 50s. And you want to really try to hold on to as much as you can. And lung infections cause that scarring and cause your lung function to drop and drop and drop. And so, yeah. So my second week of high school, I got really sick, had to leave. And that's like, I'm missing out on a lot. I was also in a career tech high school. So that's another thing I missed out on as well, actually, because I really wanted to take a career tech computer class, but you need to be there.
Right.
And they tried making accommodations as much as they could. I'm glad they didn't, though, because I was out so much in high school that it's like I would have failed. I wouldn't have like been able to be there and pass, and it's something you need to be doing in person. So that's another thing, too, that got ripped away from me and I wasn't able to do because I was sick all the time. So, I'm out. I'm doing one of those tune-ups. I'm gone for like a month. And that started to be a very constant cycle at that point in my life where it wasn't even like, I wasn't even making it to a year anymore of like how I was saying you had like when I was little, it was the year gaps.
Yeah.
It wasn't even being like that anymore. It was always a goal with like me and my dad to be like, oh, I'm going to make it to a year without a tune-up. He's like, yeah. And then we did. Nope, never did.
So how often were you going at this point, would you say?
It was like in high school, I'd say like between like 7 to like maybe like 10. I would never hit a year. So it'd be like every like 7 to 10 months. And when it was really bad, it's just started getting even less. So like maybe like 5.
Okay.
5 being the least. So those were just getting more constant.
Yeah.
And the meds were getting stronger as I kept going in, like the IV medications, just different ones and stronger doses. And that happened a lot throughout high school. And that was basically just the pattern of how it was while I was going through high school and along with those treatments as well. But with the treatments, when I started with 3 a day as a baby and being younger, it's now going up to like 4 a day. And that's with 4 a day too. I had 3 nebulizer treatments I had to do in that one treatment. So the treatments really aren't 30 minutes. They're like an hour and a half of sitting. Those increased. The hospitalizations increased.
So at this point, were you still going to school or you decided to kind of come out and do stuff at home?
Oh, I went to school.
Okay. So you're still doing it.
Yeah. Okay. I loved being there. I loved being with my friends. And all I really wanted to was to be normal.
I was going to say normalcy, right.
And be like how my friends were, because I didn't have that and I couldn't do that.
Right.
So that's all I craved. So I was like, yeah, I want to go to school and I want to be in school. And I did graduate high school.
Good.
Yeah, I'm very proud of myself.
You should be.
I'm surprised. I was never there.
Yeah. You made it happen.
I did. And my teachers and everybody were very like
supportive and helpful.
Supportive. And,
yeah, that's important.
Yes.
I'm sure there's like a lot of schools and places that are just, they don't
I've
really
heard
care.
some
yeah.
stories and I'm like,
yeah.
not
Even
me.
a friend of mine, I know that, like, side note, that got in an accident, like freak accident, and they were just, the school was just so, just like not supportive. She couldn't even stay. So.
Oh.
Yeah.
Yes.
So I'm sure places are just terrible. So that's good that they were good to you with that. Mm-hmm. It's important.
They were supportive with me from like day one of me being there.
Right.
And all the teachers and everything were very protective of me. And they're like, oh, you're sick. That's okay. Like, you missed this test. It doesn't even matter.
Right.
So I had a few teachers where I would come back from like being sick. Mm. They're like, it's fine. You had a test. I slapped 100 on it. Or I'll just take it off your grade. Mm-hmm. And it's like, you're fine. You're fine. Just do this tiny little packet or something and whatever. We'll call it a day. So, yeah, they really helped me through that.
I know. It's the life around here. Terrible.
So, yeah. So I graduated. I can skip forward now because that's about summing up about how my high school was. Yeah. Well, throughout high school, too, my lung function was dropping consistently. Mm-hmm. And you have these moments where it'll come back up and it'll go back down. But you have your baseline lung function and, you know, I was getting sicker and sicker. So it kept just dropping more. So some CF patients, too, also do not like to disclose their numbers because people do compare. I don't really care. Right. So I don't mind saying my numbers and it just kind of maps out. Oh, gosh. You're okay. Maps out it for me. So, like, the end of high school for me was, like, low 50s. And when I got sick, it dropped into, like, the 40s. Okay. So we're starting to get in, like, the danger area. Right. So I graduated in 2016. And this one started to it was getting bad, but now it's really getting bad. And in between that time, there's nothing to really fill in. Nothing crazy happened. I had some tune-ups and stuff. 2018, I got the flu, and I really almost, like, died. I was like, see y'all later. Yeah.
That was another one of those cards, yeah.
I got the flu. I ended up in the hospital, and I was on, like, high-flow oxygen. My lung function lowest point was 29. Wow. Yeah, I tanked really low. And there's some spotty things for me around that time. Probably because, you know. Yeah. So I remember with CF, there can become a time that you need a lung transplant. And I was getting to there. So my lung function was the lowest it's ever been in my life. 29 is a scary number to be sitting at. And I wasn't really improving. Mm-hmm. So the doctors, I was asleep. I was laying on my side, turned away from my dad and the doctor in the room. And they thought I was sleeping. And I don't know why they didn't just talk about it in the hallway. Right. The doctor mentioned wanting to write a referral for me for the transplant team in Boston. And I was laying there and I turned around and I started freaking out and I was like, what the fuck? I was like, what? Yeah. I'm like, what? Like, and
so was that the first time you had heard that you would possibly need a lung transplant?
Yeah. Okay. So I'm like, oh God. I just remember how it, like, always going through it kind of makes me remember how I felt in those moments. Yeah. And so, you know, that happened and the referral happened and I got a little better. So I started recovering from the flu and we're like, oh, maybe we don't need to do it. I just think no one really wanted to accept it, and we just thought I was going to be okay. I always bounce back, like in lung function wise.
Right.
I always bounce back really well, and now I just wasn't anymore. So I don't know. It's a hard thing to accept from my parents' perspective and my own, and friends and family. So that was held off for a few months, but then I just wasn't doing good. And
how long were you in the hospital for?
I was in the hospital with the flu for, I don't even know.
Like more than a couple weeks?
Yeah.
Okay, so it was a good amount of time.
Mm-hmm. And then I was able to go home. I ended up going home at some point with the flu, I believe, and then I ended up passing out and falling on the floor in my bathroom at my parents' house. And my uncle found me, and it was this whole ordeal. I don't remember a lot of that. I just remember that one thing. So then I'm pretty sure I had to go back to the hospital. I think it was flu, and then I ended up having pneumonia. Yes.
So every time you would get like something like the flu or a cold, do you usually have to be hospitalized for that, or it just depends on how bad it gets?
Yeah. Before all that time when I was a lot more sick. Yeah. Okay. It's like a small cold. Like if someone had a tiny cold that they could fight in like 2 days, no, that's going to take me like a month.
Okay.
And then longer to like bounce back again.
Right.
So my friends are always very cautious. Friends and family, if they're sick, don't come near me. Mm-hmm. But things happen.
Yeah. And
germs are everywhere.
They are.
Mm-hmm. So I'm a big germaphobe.
I am
now.
too. Yeah.
So I'm starting to recover from the flu. The highest my lung function ever got after that was like high 30s. And so we kind of just accepted it at that point. It's like, all right, I guess we'll go. So we started seeing the transplant team in Boston. And you have to go through this intro video. Oh my God, it seems so insensitive the way they do it, but I understand why they do it because it's knowledge and you need to know what's going on and how it's going to go on. But the videos they make you watch are so insensitive and harsh.
Right.
So
cold. Yeah.
This time period of my life, even to this day, is very spotty for me. I think it always will be. But I have highlights that I can remember from it. So we're sitting there on our first appointment day ever. It's me, my mom, and my dad. And my parents are really, really like into this video. They're watching the video so they know what to do when it happens, what's going on. And the life expectancy, like the just median basic life expectancy after transplant is only 5 years. And my mom heard that and she just started bawling her eyes out.
Right.
And I'm like sitting there like, what are you guys crying
about? So even after a whole lung transplant, it's still only like 5 years.
That's like the median of what they'd give you. Okay. Like there's people that are thriving with like years into the teens of having a transplant. Okay. So it differs like person to person, but.
And what would the expectancy be if you kept the lungs that you had at that low level? Do you know?
I was like 1 foot in the grave.
Okay. So it was kind of like to a point where you needed it.
Yeah, it was really getting there. And then if I got sick, because I stayed pretty healthy and pretty stable for a bit. But if I got sick one more time, I don't know. I don't know what would happen. I could have died.
Right.
I could have survived, or I could have gotten like an emergency like lung transplant. Mm-hmm. But the way that transplant works for like any organ, it is so like picky. They're very picky, and you need to be as healthy as you can be to get it.
And is that because of like the surgery and everything like that, or
it's like surgery because like your body needs to be strong enough to survive that much of an intensive surgery. And then a ton of other factors. The lung transplant is a whole nother thing in its own. So that first appointment happened, and it was just all talking and where they thought I was at this point, and then the steps on from there. And this is a very important part to me and very fucking sad, but I'm gonna be okay. So I met and it comes back to the childhood stuff too, because I met one of my best friends, Jess, during this period of time.
Okay.
And she had cystic fibrosis too. She was just as sick as me. Like, we could relate to each other so much, like very similar in what we had going on. And she was doing transplant stuff too. I won't talk too much about, her own personal stuff, but she was doing transplant stuff. So was I. So that's another thing that we could be relating to together and do together. And, I could never see her in person. We had FaceTime calls and stuff, and it was so sweet. She's so cute. Love her. So, we're in this together, and we're doing it together in a sense. A fun little transplant trip together. So I had to go do my second thing of testing, where you go in and you have to get like a heart cath, and that was like a day-stay surgery and stuff, and just a ton of different tests. And I was really nervous for that, and she was there for me too. I'm pretty sure she's done that stuff already.
Okay.
At this point. And she walked me through it, and it was great. She was there for me too, along with like my parents. And fast forward, I kept myself, the transplant team, once you're done sitting down with them and seeing them, you're kind of just on this waiting list. Well, you have to wait to be listed, and then you sit on another list to wait for the transplant. So my lung function was like mid-30s at this point, but I was staying stable. So they're like, you're on this list, not this one. So I had to just kind of wait. You have to wait till you're like practically like halfway in the grave to actually get it, which makes no sense to me.
Right.
It makes some sense, but not really.
It's like until you're in dire need.
Right.
Yeah.
So I was kind of on that one. And then I was waiting on there. And in between that time period, Jess passed away.
I'm so sorry.
And it's okay. I might shed like one tear, but I'll be okay. And it's just crappy. That's really crappy. Mm-hmm. It gives me really bad, like, she was one of my best friends. So it gives me really bad survivor's guilt. And we were really in like pretty much the same position. All CF is different, and nothing is ever going to be the same. Mm-hmm. And she had different problems from me, but it was just so similar. And we were in like the exact timeline position with each other that it's like when she passed, I'm like, why?
Right.
It's like, it's anger, confusion. And it's like, why did she have to go? And like, why am I still here?
Right. And
I've lost a few other people that I've known to CF. A lot of people have passed away. It's an illness that takes lives like that, just doesn't fucking care. Mm-hmm. So, I'm just, now I have to like live with that. And I've gotten better with it now. I don't quite feel the whole survivor's guilt thing anymore. But again, too, it's like we were in the same position, and I try not to compare, but like, why her over me?
Right.
And so I had that to deal with. And after that, I kind of felt really just down and crappy, and I was like, I don't want to do this anymore. Like, I don't want to do transplant anymore. Like, I just don't care. That was like a side thought, because I really did always just take care of myself. I never really stopped. But yeah, she's very important to me, so I wanted to talk about it. But she's that was really rough.
Sure.
Especially in such a hard time in my own personal life.
Absolutely.
And then that. So now getting into the brighter side of stuff. Throughout this little time period, they had medications come out through Vertex that was like trying to help make CF less like make it manageable.
Mm-hmm.
So I was on Symdeko, was the first one I ever tried, like a few years back. There's not much to say about it. I don't really remember it doing much. And then I went on Orkambi. I was on Orkambi during this period of time through my transplant stuff. And I think that was a part of something that kept me kind of stable, because it did a little bit. I think it kept me stable.
Right.
Like, in those 30s, 40s area. And then something like, I don't know, like life happened really strange after this, and it all takes a beautiful turn now. So, all that stuff happened with Jess. I was working on just trying to get better. There was talk in the air about this new crazy medication that's coming out, like a genetic modulator. You really can't say much about it because it was in trial testing. And Jess was still around a little bit when it was in trial testing, because we talked about it a little bit, and we're like, oh my God, this is going to be great.
Yeah.
So that's another thing too that like hits me. I'm like, come on.
Right.
So I did one more tune-up 3 years ago. I did one more tune-up. We really went full in. Did a nice little mix of like 3 different antibiotics for like 3 weeks, 4 weeks. And my lung function just shot up to 51.
Wow.
Like that hasn't happened in so long. So I've been struggling going through this transplant stuff for like so long, and then out of nowhere, after this tune-up, right up to 51.
And then so at that point, they're like, you don't even need the lung transplant?
Well, I was still on this like back
right, like
list.
Just in case kind of thing.
Yeah.
Okay.
Because I'm not on the waiting list, but just on the back burner.
Yeah.
And so, yeah, I mean, that happened, and I kind of stayed stable for the next like few weeks, because
was this with that new medication or not yet?
Not yet.
Okay.
So
this is with the concoction that they made.
They hit me with that concoction, and they're like, we want to get you to the best point we can get you at to start this new medication. And I was like, all right, yeah, whatever. Not much hope. I'm like, whatever. Yeah.
Do what you need to do at this point.
I'm like, whatever. So we do that. That happens. And then Trikafta is the medication that came out. It was showing insane improvements in people with CF. Like, when you're born, you do a sweat chloride test, and like if the numbers are like high, it's like indications of CF and stuff. Some people's sweat chloride tests were coming back like showing no signs of cystic fibrosis. Crazy stuff.
Yeah.
Like 10 to 20% lung increase for lung function.
Wow.
Weight gain, like crazy stuff.
Yeah.
So it came out, and I started it, and that's how I'm like here now. So my whole thing is, because I know like they did that little concoction of stuff and I shot right up, but if I were to get sick without the medication that I have today, I would have went right back down.
Right.
And maybe even harder.
Yeah.
So if it weren't for this like life-saving medication, that was 3 years ago. I wouldn't be here. I would be dead. Like, for sure.
So after they started that medication, were you still going back for tune-ups?
No.
So you don't
it's
even
why-
have
This
to
is like a whole
anymore.
nother like section.
Wow. That's
Yeah, so
crazy. I mean, that's amazing. Really.
It is. Thank you too.
No, of course. That's great. That really is.
It was insane.
Because at this point, how old were you at this point when they introduced this medication?
20.
Okay, so 20 years of your life, you've been dealing with that.
But I didn't start until I was 21.
And now you're 24. Okay, got it.
Um,
Right, so that was 21 years of dealing with all of this basically up and down.
Mm-hmm.
And when you're down, you weren't down for just like a day. It was like, periods of time.
For a while.
Yeah.
And also just like sitting on the thought too of like, oh, when when am I checking out of here? As in like dying.
So quick question before you go into your next segment of life.
Yeah.
What is the typical life expectancy? Or does that also depend?
It depends on severity.
Okay.
And also when I was born, it was like, I think it was like early 20s.
Okay.
When I was born. Because that's what they ended up telling my parents.
Right.
But then my case was more severe. So then, that's chimed in too. It's really just like a ballpark type of deal.
But it all kind of depends person to person.
But now this medication is wild. So like I'm going to sum that up and then that's kind of it.
Okay.
But this medication is so wild that it's changed so much that children can take this medication when they're old enough. I'm not sure quite what the age is to start being able to take it. It can change your whole life. It can give them a full life. I'm probably going to have a full life.
Wow.
Like I'm probably going to make it well past and like see like I want children. So I'm going to probably see, if I have grandkids, I'll probably be able to see them now.
Yeah, that's incredible.
To where like I shouldn't even be here right now,
Right.
So it's really done a toll on the mental health to like
probably
switch
like to
like
make
that.
you more positive. Yeah.
No. Like yes and no.
Yeah. I mean, obviously, I feel like there's always going to be shit that we feel like can get us down, But I think in general, to some degree, at least you're not kind of just like taking the odds of like, okay, like when is my time? I mean, I feel like anybody can say like, when's my time? But at least now it's like there's some sort of positive, medication that can really give you hope and give you all these years, which I think is so important.
That is a positive aspect.
It is.
I think more of like the negative aspect that I was
a lot of
thinking
people
is,
do.
like,
It's easier to think of the negatives.
It is. It always is.
Mm-hmm.
It's just like, I think it was so strange for me mentally to have to rewire my brain to be like, oh, now I can live a full life.
That's what I was saying. Like for 21 years, like to live one way of just constantly not knowing and being so used to getting sick so often. And then honestly, watching it go down the older you got, like, yeah, to rewire and now almost even believe like, oh, there's a medication that can completely change this bullshit, like,
yeah,
right.
Exactly. Like, it isn't.
Yeah.
But it has. So it's like, I'm still even trying now to this day to be like, oh my gosh, like accept it.
Right. Like just take a breather and like let it be.
Right. So I'll try to explain this the best I can. I started the medication and with CF, you cough a lot. Like I haven't really coughed much, like at all. If you met me beforehand, that's all I would do is cough and cough and cough because you're drowning in mucus, literally. So one of the first things I noticed with that medication is I coughed a lot, but I got a lot of stuff up. And then one day I just woke up and I wasn't coughing anymore. Yeah. And I would cough so much to the point where I would throw up, or like, it got so bad to the point where like, I'm like throwing up and like pissing my pants. Yeah. Like from just coughing. And I'm like, this is awful. But anyways, so one day I woke up and I'm just not coughing anymore. And it just, I haven't coughed like that since. And that's wild to me because I spent so much of my life just coughing, and it seems very like not a lot, but it was like aggressive coughing.
No, I've heard it. Now that you say this, I knew of a girl who had cystic fibrosis, and I remember that being, I think, something that I don't know if she said it or maybe when I researched it on my own. I mean, this was years ago that I read that, and that it was the same kind of thing that people would think, oh, coughing's no big deal, but it's not your normal when you're sick. It's like nonstop and very aggressive to the point that you could throw up and piss your pants and whatever else. I actually forgot that I did hear that years ago.
Yeah, so that's really something big in my personal life that I was like, wow, like this is
Huge
a life
change.
changer for me. I would get so winded even just walking up like one set of stairs, and I was finally able to like walk up multiple flights of stairs. And I'm like, this is so cool.
Yeah.
Like, I can do the stairmaster.
I'm a superstar
at the
now.
gym.
Yeah.
I'm like, okay. So that was crazy too. And like your O2 stats, you know, when you put the thing on your finger, they were always so low for me. And now I just hold like a normal, healthy O2 stat. And so we had my lung function that was always so up and down. And I had that nice start of a 51. I got my lung function up into the 70s. I haven't been in the 70s since I was a toddler.
Right.
And that shit dropped like that, like real fast when I was young.
Yeah.
And so now the fact that I've been able to just maintain that and it's not
really
going
incredible.
anywhere,
Right.
I'm like, wow.
Right.
I used to be like, you could see like my bones with my, I lost a lot of weight too. Back during transplant time too, I was like skin and bone, and losing weight like rapidly, and so I put on like healthy weight. I look like a healthy person.
So with that, did you have more of an appetite, or it was just like kind of keeping things down?
Oh my
easier?
goodness, yeah.
Okay.
the med makes me eat so much. Even to now, my appetite is like huge.
Okay. So it was like an appetite increase and everything.
Yeah.
Okay.
And then I was like with CF, you can't really keep that weight on.
Okay.
But with Trikafta, that was helping me keep weight on. So it's like that's another great thing that came from it too, because with higher weight becomes more lung function too. It's a nice little balance.
Right. So you got the lung function up.
Yeah.
To like 70s.
Yep.
Appetite was up. Everything's looking up.
Everything's going up. And everything is going down in a good way too. My liver function was something that was concerning too for a bit. So that was like, oh. But now it's like almost next to normal.
Yeah.
So that's pretty cool too. So that's like, I'm just a normal human being now.
Right. So you don't need to do your tune-ups now.
No, I haven't had one in since the last one.
Wow.
Like 3 years.
Do you still have to do what were they called?
The treatments?
Yes.
No, I don't.
No treatments. Wow. So literally there's nothing you technically have to do in your day-to-day life.
Except like pills.
Okay.
Which I do have like a few of those. Like I have the Trikafta that I have to take every day. It's 2 in the morning and like 1 at night.
Okay.
My pancreatic enzymes, those don't go away. My pancreas still don't work. That's fine though.
So, and is that for the food?
Yeah.
So you still do have to take those enzymes every time.
Yeah, all the
you
time.
eat. Okay.
Probably for the rest of my life. That's not going to
I
go
feel like
anywhere,
with
but
that-
that's like a
I was going to say that
trade-off.
by now it's like it probably is like second nature. Like if you eat, you have to do that.
Sometimes I do forget though, and then I panic.
Yeah, I would too. Right. I mean, if you know you have to take something, then you forget. You're like, oh shit.
Yeah, I know. I'm rushing. I'm like, oh,
Yeah.
fuck.
Right.
But that's still a thing. But I mean,
compared to the other stuff, right?
yeah, it's like taking like, I don't know. It's just so second nature to me. Like you said that.
Yeah.
It doesn't even matter.
And it's easier. It's less time consuming. I mean, to take a pill is like you just do it and you move on.
Yeah. The whole treatment thing. Excuse me. So the whole treatment thing was a bit of a fight at first with my clinic because the drug was new.
Mm-hmm.
And we didn't have a lot on the pulling treatments back aspect. So they're like, let's not do that. But I did it anyway. Because I just felt so good. And like, if you were to able to feel the difference of like all the mucus sitting in there and just the congestion, the cough and stuff, all of that just, gosh, gone. And I'm like, I don't know, like a completely different person. I feel completely different. That it's like, I just felt personally like I didn't need them and that they became pointless. And I still use them. I use my nebs when I'm sick. So I did have COVID.
Okay.
Back when COVID became a thing.
Right.
it wasn't, it would have killed me probably back then, but I actually took it like a champ.
Wow.
That wasn't too bad.
So now it's like you think if you were to get the flu, it would not at all be the same.
I'm terrified of the flu. I don't even want to know.
Okay. But hopefully since everything is so high and good, your body would have a way easier time fighting it off.
Probably a better chance, yeah.
Okay.
Flu terrifies me. That's why I hate the winter, the flu season.
Mm-hmm. Right, any illness, terrible.
Yeah, so I think my body would handle the flu a lot better, though. So basically, I kind of just pulled off my treatments by myself against my doctor. And I was like, well, I'm not going to do them anymore.
Yeah, if you feel good
because
enough.
I'm doing them, I'm sitting there, and like the purpose of it is to cough stuff up and get that mucus out. I'm like, I don't have anything in there.
So you weren't even like coughing up anything at that point?
No.
Okay.
It's like if I did, it's like clear, normal stuff. And I kept telling them that over and over again, and my lung function just kept going up and just kept staying stable to the point where I think they kind of just leaned off of it, and they're like, all right. Yeah. And then I haven't had confirmation from my clinic to say that Trikafta can cause for you to come off the treatments, but I do have some other friends that have pulled off theirs too, and they're like, I'm fine.
Okay.
So now I haven't done treatments in like 3 years.
Wow.
I'm like, thank God. They were so time consuming. I hated them.
That's really, really amazing.
It's
It's life-changing. It really is, because I mean, when you have to do something like that, and so many of those kind of things, like you said, it's time-consuming. It takes away from your day, from your life, and it's almost like you've gotten your life back.
Yeah, and I'm making up for lost time.
Yeah.
I missed out on a lot of like get-togethers with my friends. Well, they would wait for me, but you know, all your friends are together, and then you're coming in last. Yeah. And I had to be last because of the treatments and stuff. It's like, ugh.
Yeah.
So that's something I missed out on too. So I'm just making up for lost time.
As you should.
Yeah.
That is great.
Yeah, it is. It's pretty cool.
It's so good. So good. Do you have anything else, or are you good?
I think that's really like, that sums up all of most of it.
No, you really did incredible.
I'm probably going to look back on it and be like, I missed that. But I think I summed up everything that I think is pretty stapled and big and important.
No, I learned so much. I think it's incredible. I'm so happy for you. Really. I mean, that is just like, it's incredible to hear. And I think it's so positive, because I feel like we don't often hear about like, I mean, at least not me. Like, I don't hear about these like miracle drugs. I mean, I know that there is other ones, but like to actually hear it firsthand and hear your story and how your life was literally changed by that, it's incredible. And I'm so happy for you. And I'm happy that you are making up for lost time, and, you know, you feel like you can live, honestly, you know, and I just think that's amazing. And I'm so glad you were able to come on and share your story.
Thank you.
Of course.
I was happy to be here.
Of course. You did so good. Really.